This podcast is brought to you by Podcast Nation.
This episode is brought to you by Shopify. Upgrade your business with Shopify, home of the #1 checkout on the planet. Shop Pay boosts conversions up to 50%, meaning fewer carts going abandoned and more sales going cha-ching. So if you're into growing your business, get a commerce platform that's ready to sell wherever your customers are. Visit shopify.com to upgrade your selling today.
Welcome to Nirvana Sisters podcast, where we take the intimidation out of well-being and beauty to help you achieve your highest state, your nirvana. We are sisters-in-law and your hosts. I'm Amy Sherman.
And I'm Katie Chandler. So let's get into some real conversation.
Welcome back to the show, Nirvana Sisters family. In this week's part 2 episode with Dr. Debra Block, we really get into the details. So last week we talked about why chiropractic care is good for you and all of the benefits. But this week we really go deep into things you can do on a daily basis that can help you, what to expect when you go to the chiropractor, what to look for, and more. So enjoy this episode. It's full of tips and tricks that we think will be really helpful.
Amy, I'm curious why you were so scared of the idea of being adjusted. I mean, I love going in and getting my neck adjusted. And I know didn't you tell me, Amy, that the whole thing kind of freaks you out, the whole neck adjustment?
I just want to tell you that Amy's asked me to rub her and touch her and examine her.
I love a good massage and good hands on my neck.
I mean, always.
Just the idea of
our whole
moving your bones into a different place, only because, and I'm sure people that are listening feel the same way, you've heard the horror stories of oh my God, I went to a chiropractor, I got my neck adjusted and I can't move. Or you hear these, and it's myths. And that's one of the things I wanted to ask you, Debbie, those common myths that people hear about. And I think that's why it was always, because it's not just you're adjusting the body. And if you don't go to someone good, something could happen. I mean, you're super qualified. And of course, I trust you with everything. So I felt so good. And it was funny, Katie, because Debbie was like, oh, I can refer you to someone closer. You don't have to drive, half an hour to see me. I'm like, no, I'm not going to anybody else.
Right.
It's it's intimate to your point, and you want to trust the person you're with. And so I think that's why I just had to get over the fear. And now I would happily go back to do it. But I think there's probably a lot of people that feel the way that I do. So Deb, what are you seeing as myths that you can dispel for people?
There's lots of people who feel that way. And I do a tremendous amount of work. My psychology degree really helps me with every single person. I can sense and pick up on that even when someone's not telling me. So I really I've learned how to, and it's one of the, it's one of the things I think every doctor should have is an understanding of where their patient's coming from and being able to sense their own comfort or discomfort. But yeah, no, I do a lot of communication and explanation. And if I have to go really slow with people, I do. We have non-aggressive options that if I have to start out, with an instrument instead of my hand so that they're not feeling the vertebra moving, then I will do that. But I do a lot of communication and a lot of explanation to get patients to feel more comfortable and, ease into it slowly. There are a lot of myths. Some of them are kind of laughable. My favorite one is, hey doc, I've watched Jackie Chan movies and he always breaks people's necks. And are you going to do that to me? Half the time I want to be like, how dumb are you? But I don't say that. But first thing I say is, okay, that's a movie, that's real, that's fake. And I never took that class in school. I never learned how to break necks. I only learned how to fix them. No, I mean, are there any, concerns and real reasons to be concerned? It's few and far between. And I will tell you that malpractice insurance wise, this is always interesting to people. When you look at healthcare providers, we have the lowest malpractice insurance cost of any healthcare provider because it's relative to the amount of injuries that are caused by the people in your profession.
Wow.
So the number of malpractice suits for somebody having been injured by a chiropractor are very, very low. So chiropractors malpractice insurance, like in comparison to a gynecologist, an OBGYN, who's, I don't even know what the numbers are, but, really exorbitant, chiropractors are really, really very low rates because we really don't have many injuries. There are myths. The biggest one probably is, besides this, one that I just shared before, is stroke. That's, people are like, am I going to have a stroke?
Yeah.
And where that comes from is that there are patients with stroke symptoms that present like lots of other chiropractic patients: neck pain, headaches, fatigue, range of motion restriction. Those are typical for a stroke patient. And they walk in and they are most likely going to have a stroke sometime within the next few weeks. And if I were to do a Doppler ultrasound on those patients, which would evaluate the arteries in the neck, I would most likely see a clot, what's called a thrombus, sitting in the artery waiting for that moment. And so if we don't properly screen for those patients with those issues, is there a possibility that we could adjust them and they could end up having a stroke a couple of days later and then thinking it was the chiropractor who did it? Yes, that's happened. And chiropractors have had issues, with that before. But it has been proven that it is not the chiropractor that caused the stroke. The stroke was going to happen, but the patient came in with symptoms similar to neck pain, headache, patients, and the chiropractor that treated them didn't catch it, because a Doppler ultrasound is not something you're going to order unless there's, a very clear reason to do so.
Yeah. So let's talk about that. Let's talk about when a patient comes in as a new patient, the screening that they go through, the diagnostic processes that you do to decide,
Sure.
what they need, et cetera.
Yeah. So obviously, patients fill out a lot of paperwork before they come in. They give me their whole health history as well as their genetic family history. And have they had chiropractic care before? Have they had traumas? Have they had car accidents, athletic injuries? So we get a little bit of a picture just from what they've filled out on paper. And then we sit down and have a detailed consultation where I ask all of those questions and we talk about them in depth. What your family history is important. If you're a smoker, if you're a drinker, if your job requires you to be on your feet or physical or sitting at a desk all day long, what your stress levels are, what your sleep and hydration and nutrition and exercise look like, what your pain is now, how you're describing it. Some of those descriptors can be really red flags for us. Worst headache I've ever had in my life is a big one. That's a refer out to hospital. They're most likely about to have a stroke or about to have potentially an aneurysm. I've caught some scary things in my time. I actually just had a patient who came in post colonoscopy with a whole bunch of abdominal pain, and she was 41, works out 7 days a week, in amazing shape, and was coming to me for maintenance care to keep her spine in good alignment. She went for a colonoscopy routine and ended up having all of this abdominal discomfort 2 weeks later. And both her gastro and her regular doctor told her, don't worry about it, give it some time. I was alarmed. There was something off about it. I said, you need to go right away and have an ultrasound done and let's see what's going on. Turned out she had a ovarian tumor the size of a grapefruit.
Wow.
We ended up in emergency surgery within the week.
Wow.
Oh my God.
Oh, I just got chills.
So, once in a while I have that kind of case walk in my office. I have referred out probably 4 or 5 strokes in my time. Usually they walk in and they're pretty obvious. Usually it's an older person. It's somebody who is slowed. I literally had a woman once years ago come in a wheelchair and she wasn't feeling well. Her husband's pushing her in a wheelchair. She was in her 60s. And one of her feet, how in a wheelchair, you've got those foot pedals where you put your feet on. The foot pedals were up. And she was able to hold her left foot, holding it still, but her right foot was literally dragging behind the chair. And I'm like, 911, something's not right. So yeah, we do have things like that walk in. So yeah, being a good diagnostician and not just looking at the spine, but looking at everything, to the point of you guys talking throughout your podcast about kind of an integrative healthcare approach, which I think is ultimately part of your message. It's really hard to look at someone nowadays, especially, and not take into account their gastrointestinal health, their cardiovascular health, their gynecological health, their endocrine health. I mean, all of those things play a part in what I'm doing if I want to be a good doctor.
Right.
So I talk to people about all of these things. And then once I get a really good understanding of what they're experiencing and what they're feeling and where they've been, then I have them go through a range of motion. I'll look and see how they're moving in their lower back and their neck and their upper back. I'll do some orthopedic testing to see if there's an obvious sign of problem in the spine. And if they're having neurological symptoms like numbness, tingling, burning, loss of muscle control or weakness, then I'll do some neurological testing. We also will palpate the spine and feel the areas that are bothering them to see what we can pick up with our hands. And then if necessary, depending on the age and the issue that's going on and the history, I'll often refer out for either x-rays and or an MRI, depending on what they're dealing with. If I'm referring out for films, I bring them back and we go over the films. Once they've come back, we go over the findings and then I'll treat them. If there's no contraindication based on examination and history, then I'll usually treat on the first visit.
Okay.
Yeah. And what I was going to say, I mean, you're obviously extremely thorough, and I would hope that most other chiropractors are, but they probably might not be. So like, how does someone find a trusted, good chiropractor? Like, what would be the best way to do that?
That's a good question. I wish I could say there wasn't differences from one chiropractor to another, but I think that's probably true for every healthcare.
Every kind of
everything.
Yeah,
Absolutely.
And every industry. There are some that are going to be, more in tune and aware and concerned and focused, and others who are going to kind of treat you more like a number and get in and get out. I always tell people who are moving to other states to ask, nowadays with technology, there's so many great places like, besides Facebook and neighborhood listservs, there's also, that neighborhood app?
Nextdoor.
Yeah. Thank you. Yeah. Nextdoor. So there's lots of good ways. I mean, where I am, there's always people asking for, who's a good chiropractor in town. And I'm always watching to see what people are saying. So there's lots of referrals. I would start there, look for who else other people are seeing and, talk to them, especially if you've got something specific going on. Like I think you mentioned earlier, I treat pregnant women, but many chiropractors do not. So, if you're pregnant, you would want to look for other pregnant women who have seen a pregnancy trained chiropractor, because we are, a unique bunch. Mm-hmm. And it's not something that everybody is well versed in. So looking for referrals, looking at people's websites, what somebody puts into their website, I think really makes a difference, and seeing how that resonates with you. And then honestly going and meeting them. And if after that first visit, you don't feel like they're a good match for you, then you need to move on and go somewhere else. Yeah. I think trusting your own intuition about how that person feels, do they make you feel comfortable? Do you feel trusting? Do you feel like they know what they're talking about? Those are the things that I would recommend.
That's good advice.
Yeah, that's great advice. Yeah. Can I ask personal questions? Can I get a little diagnostics?
Yeah. Amy knows I'm very honest and revealing. So ask whatever you want.
Well, I'm just curious. So, and we talked about this actually. Debbie's the whole reason why I went to a chiropractor recently, because we chatted on the phone not that long ago, and I found a great chiropractor that I'm thrilled with. I feel like they went through all the processes that you just explained. I feel, really good feeling about them. So she did an x-ray and we found out that my hips were like misaligned. And I'm thinking I guess I'm just curious, like, is this something that I was born with and it's just now aggravating me? Is this something that is happening over time? Like how does that even happen?
How old is your youngest, Katie?
My youngest is 4. My oldest is 8.
Okay. Were you somebody who carried your kids on your hip a lot?
Yes.
On your side?
Yes.
Okay. And do you remember which side you carried?
I carried them on this side all the time, on my left.
Which hip is high?
I don't remember exactly, but that makes perfect sense.
It's your left.
I bet
it's your left.
Yeah, that makes perfect sense. But it's just not bothering me so much,
It's because you spent 8 plus 4 years carrying your children.
Yeah. Yeah.
I mean, I don't know how long you were carrying your older one, probably up until your younger one was born. I would imagine you probably spent about 4 years, off and on carrying each of them. And that in and of itself, it's amazing. One of the reasons I got into pregnancy work is because I saw this huge void for moms, both pregnant moms and women after they give birth. I mean, in my opinion, that's the most physically taxing thing that we go through. And there's not much you can do to relieve your discomfort while you're pregnant. And post pregnancy, after you give birth, my God, you're barely sleeping, you're changing diapers constantly, you're breastfeeding or you're bottle feeding, you're bending down. And the biggest thing is that, and this is what I think is amazing about moms, women, we forget about ourselves because our maternal instinct is so strong that whatever our children need, our needs are like, we don't even hear them. So if you have something in your head that says, watch how you're bending, forget it. My kid's crying. I'm picking them up and putting them on my hip. So I watch moms every day put themselves into compromising positions at the detriment of themselves for their children. And that, I think, is just part of our DNA. So if you're not going to someone or exercising, stretching, doing yoga, doing all of these things to counterbalance what you're doing on a given day, especially when your children are young, you will feel it and you will have issues. And I have like a kids free policy in my office where I say, bring the kids. If it means I can fix you and you don't have to pay for a babysitter, just bring them. And I've got toys in my office and sometimes we have lots of screaming kids, but it's okay because I'm there to help the mom. And I sometimes help the kids too.
Yeah, that's a really good message because you're right. When you first have a kid, you're not even thinking about that.
Right.
And so it's like the last thing you would think about is like going to get adjusted.
Do you remember when you're walking into your kid's room and they're crying in the dark in their crib and you're like, are you thinking about how you're leaning into the crib to pick them up? No. They're like 20 pounds and you're like,
right. And it's like, you're not also in that phase where you're thinking about taking care of yourself. I feel like that comes a little bit later. So you're not even thinking like all the things, like maybe if you knew what you knew now, you would maybe bend differently or whatever. But I remember too, when my kids were born and I was holding them so much, my like wrists and forearms were like killing me. And I was like, this is so strange. And I was like, oh, whatever. Right. You just ignore it.
Right.
But that's so interesting. I never thought about that.
I know. That's a really good message. Trying to educate my new moms about create space where you take, let your kid cry for an extra 20 seconds so that you can put yourself in a better position before you start breastfeeding, or, don't change your baby on the floor, let your baby, have a poopy diaper for another couple minutes, and take them to a more ergonomic place for you to change their diaper. Things like that. Just thinking about, doing things differently so you're not harming yourself. Yeah. So yes, Katie, your hip, I would look to that. But one of the things that I do a lot with hips like that, especially if you see on x-ray that there's a misalignment, and you can ask your chiropractor this, sometimes there's just like a little insert that you can put into the shoe. It's like cork, and it can be anywhere from, like 3 millimeters to 9 millimeters, but it can go underneath the insert to your shoe, and it'll just take your low hip. So if your hips are like this, you put it in this shoe so that your hip will come up and balance.
Oh, that's cool. Interesting. Okay.
It's called a heel lift, and it's just a very benign something that like I usually sell, especially for someone like you probably need a bunch of them for all your shoes. But
I was going to say, do I have to switch it every time I wear a different pair of shoes? Because that would be a problem.
And then just stick it in your shoe, and then you don't even have to think about it.
Yeah, no, that's
interesting.
That's a great tip. I'm definitely going to ask about that, because I like, it's the alignments and the adjustments are without a shadow of a doubt helping, but it's not fixed yet. And I can tell. And my other question for you is, like, they want me to come 3 times a week. So when someone is first coming to you with a problem, how frequently do you like to see them? I can't get in 3 times a week. I'm trying, but it's like really once. What do you suggest?
So, that's like a kind of a common, that's also a common myth, or, one of the things I had thought about when you asked me that question earlier was, do I have to see the chiropractor for the rest of my life? Like, I don't want to become an addict and, feel like I need this forever. That's, a very common myth. when somebody first starts care, depending on the issue and depending on what's going on with them, having them come 2 or 3 times a week is usually what's recommended for the first 4 to 6 weeks. And the reason is not because we're trying to get as much money out of them as possible, but it's usually because the chronicity of the problem has been there, especially with someone like you and what you just described. It didn't just happen overnight or over the last couple of months. It wasn't like you slipped and fell 2 weeks ago and now your hip's been bothering you. It's probably been building for quite a number of years. So to correct it is not something that's going to happen with 1 or 2 visits. And if we see you once a week or once every other week, you're probably going to return to the lifestyle habits that you're doing that are aggravating it. And so it's kind of like a Band-Aid instead of really trying to address the underlying problem, which we can do more readily if we see you in a closer together period of time. And then we're telling the spine once it's coming out of alignment, nope, you got to go back to this position. And then we're also encouraging you while we're working on you to talk to you about how are you sitting and how are you sleeping? And tell me when you sit down on the couch and watch TV, are you like, folding your legs underneath your hips, or are you, thinking about where your legs are? Are you walking around the house barefoot? Or, like all of these little things about your daily life are going to impact your healing. So I want to both treat it regularly for the first 4 to 6 weeks, and I want to educate you so that you're doing the right things when you're not with me to help facilitate the healing.
Okay. All right.
So someone would potentially go 4 to 6 weeks and then they're kind of in maintenance mode after that.
We have everybody does it a little bit differently, but we have 3 phases of care, and I call it acute for the first 4 to 6 weeks, where I'm really trying to get you out of pain. The second phase is another 4 to 6 weeks, but we're seeing you less frequently, once a week, once every other week. And that's called stabilization, where I'm trying to just stabilize the issue. And then we move you to maintenance, which is typically once a month or once every 2 or 3 months. And then I'm just maintaining what we've done, kind of just making sure that you're still staying where you are. And, that frequency can extend out if everything seems good. But periodically, I just want to check your issue and make sure that, like the dentist, that you're coming in and that your spine is aligned.
Yeah. And I think it also depends on the severity of the issue, right? Because when I came to see you, I came in a few times, but they weren't in the same week. I think it was like once every few weeks until I felt better.
Yes.
And, now I haven't been back. So I think it also depends.
How are you feeling? Can I ask?
Fine. Yeah,
Good.
Totally fine. I think, just sometimes my neck will be in pain, but I'm a little bit more aware of it. I'm trying to stretch. And that's what I was going to ask you too for our listeners. So I love all the tips you just gave before. What are some tips, like good stretches or things that people can do every day to keep their body in alignment? A lot of people are sitting on computers. Like, what are small little things that people could start doing today?
So my biggest recommendation, and I do this every single day, is to foam roll. I absolutely love foam rolling, and I think it is good for every single spine. We spend so much time compressed, both at the computer, at work, with our children. We're in this like compressed, forward flexed kind of state. And if you can open up your spine and extend it and have a foam roller that kind of is rolling across it and helping you to just elongate and extend, I think that's an awesome tool. And there's so many videos on YouTube that can show you how to foam roll. And that's a really inexpensive something that you can buy at Walmart or Target.
Yeah, that's a great tip.
So foam rolling, number 1. Number 2 is when you are someone who's sitting in front of a computer all day, or really anything and any job, I recommend stretching your neck. And I recommend stretching it in 8 different positions. You both are doing it. So if you guys just both did lateral flexion, so left and right lateral flexion, then you've got what we call flexion, which is going forward, extension, which is going back. And then you've got rotation, which is turning to each direction. And then my favorite one, which is I call sniff the armpit, where you're actually bring the nose to the armpit and put your hand on the crown of the head and pull.
Oh yeah, I love that one.
Oh yeah, that's a nice one.
Right, you showed me these and I haven't been doing them.
Yep. So that's going to really help both with the lower neck and the upper back. And Katie, what I then say is take your nose and take a deeper sniff. So go a couple degrees further in and then pull down towards.
We're going to put this video out so people can see it. This is hilarious.
And you'll feel the upper back. It's also a good opportunity to make sure that you're not smelly.
That's great.
Yeah, that's really good because you can just sit at your desk and do that when you're on a call. I forgot about those. I need to
one more that
again.
I would recommend when you're in the car, and this is good for my stage of life where I'm constantly driving my kids to a million different places, is I'll, just periodically, I recommend doing it at a light, not while you're driving, but I'll just retract my chin into the headrest and just kind of push and hold. And that helps to strengthen the anterior neck muscles. And we spend so much time on what we call forward head carriage with the phone and the computer, that by doing that and kind of using your headrest in your car, it really helps to remind your neck and your head that your head should really be right on top of your shoulders. Ears should be right on top of the shoulder rather than here. So kind of pulling back, retracting like a chicken and pushing the head into the headrest and holding for 5 and then relaxing. That really is helpful.
Yeah.
Yeah. I love all these tips because it's, I think, integrating these things into the things you're doing in your daily life. So it's not an extra task. It's like you're in the car anyway, you're at a light, do that, right?
So
I
easy.
sometimes do that with like one nostril breathing when I'm at a light just to relax. So I love that. Okay. So quickly, before we get into our wrap session, Deb, I want to hear about, running your practice as a businesswoman, because not only are you taking care of people on the daily, but you're running a really successful practice and it's a lot. So give us your kind of POV on that. I know you like that side of the business, but it's very different.
It is. It's hard. It's great. And I love it. And I think I love it because I like people a lot. And I think what makes you good at it is being good to people and knowing how people want to feel. So I think, I've always been a people person, and I knew that I wanted to go into a field where I was working with people. But there's a difference between working with people and really being in the right space in terms of helping them to feel both not intimidated, welcomed. My patients, I have a community of people who most of them come in and hug me hello. I mean, even, now we ask, like, is it okay if I hug you because of the pandemic? But, I have an environment that's really friendly and warm. And so that part of becoming successful was easy for me. And I'll just back up and tell you that I have a father that's an entrepreneur. So I kind of grew up working in his office and watching him build multiple businesses. And so one of the boxes that I wanted when I was in college and trying to figure out what my career was going to be was a job in which I could be my own business owner someday, knowing that I could be a mom and that I could have a family and I could also have a business. And in healthcare, that's a little hard because I didn't want to be on call. I didn't want to be, needed on the weekends. I didn't want to deliver babies in the middle of the night. So this field fit for me in that regard, that I knew I could create my own practice and my own business. But yeah, it is hard. I definitely have a lot more gray hair as a result. You can't tell because I highlight, but yes, it's stressful. And the hardest part is probably just managing people, staff management. And right now in the pandemic, this has been the hardest 2 years of my life. Being a healthcare provider through a pandemic has really been challenging. I think healthcare providers have very much been on the front lines with teachers. Teachers were, I don't want to talk about teachers. They went through their own, challenges, but Amy and our other 2 closest friends and I have been on a text thread since a couple of days before the pandemic really hit. And I was the only one going to work every day. They were all home, working from home, and their careers and jobs continued in the comfort of their home. And I was home for 6 weeks and then back in the office with a ton of PPE on, having no idea if I was going to bring COVID back into my home, but having too many people in pain and hurting that I had no choice but to go in. So it's that part of the responsibility of being available for people, in a snowstorm. Like, I usually open and I'm usually there because I feel a responsibility to be. So it's an awesome reality that I've created this business and that it's successful, but it definitely comes with a lot of stress and a lot of burdens that, people who don't own businesses don't really know from.
Right. But you wouldn't change it.
No, I wouldn't, because I absolutely love the freedom and I could never imagine having someone tell me what to do now.
Totally.
Yeah.
I feel you on that. Okay. So we're going to get into our wrap session. So besides keeping your spine aligned, what would you say is your favorite wellness or beauty hack?
So I told you about the foam rolling. That's definitely
Yes.
number one. And number two that you might, that we didn't really touch on, and this is a big one for me, is I take a CBD gummy every night before bed.
Nice.
And I started doing that over the last 6 months, to 9 months or so, both because I feel more discomfort physically than I used to. And hormonally, I am in a stage where I was like waking up in the middle of the night every night at like 3 a.m, like on the nose and wide awake and couldn't get back to sleep. And so that insomnia was something really new for me. And the CBD, which has really awesome anti-inflammatory benefits, helps me to stay asleep. And I have an awesome night of sleep because of it.
That's
What
great.
brand?
So I actually sell this brand in my practice. It's called Noetic Nutraceuticals, and it was created by a friend of mine who I believe, wholeheartedly in his science and in the process in which they went through to create it. And that's probably a whole nother podcast in and of itself. But not all CBD is created equal.
Yes, I agree with that. Go ahead.
Yeah, but no, that's probably my best health hack besides the foam rolling.
That's a good one. I'm gonna have to try it because I was doing CBD like tinctures for a little while at nighttime. This was like during the pandemic in the beginning, and you're right, they're not all created equal. Like I had to stop because I don't know, it wasn't working for me. But I would really love to try that one. Okay,
Sure.
The next one we call it our 5-minute flow. Just got out of the shower. Uber pinged you. They're 5 minutes away. What are you going to do to get into that Uber on time? Get yourself ready. What are your holy grails, your go-tos?
Amy's going to totally laugh at this, and she could probably answer this for me. And the answer is Uber's going to have to wait. That's like never a possibility for me to get out the door in 5 minutes. There's a joke. I have an issue with punctuality. So getting out the door in 5 minutes, Uber might have to wait an extra minute or two. But yeah, what would I do? I don't ever get dressed without putting body cream on all over, face cream, legs, hands. I think I'm like a little dry. So like if I don't do that, I feel weird. So that's number one. Number two would be hair gel. I have curly hair, as you can see. And so like just throw hair gel in and then run out the door, and mascara, lipstick, even during masking, lipstick.
Wow, really?
Yeah.
Just
I don't know.
Just to make you feel good?
Yeah.
Made you feel like finished. Yeah.
Finished, or like, like going out lipstick.
Yeah.
I like
That's
that.
good.
That's great.
Okay. And how do you maintain your daily nirvana?
Oh, that's a good question. And to be totally honest, there's lots of days where my nirvana is missing. I think it's hard. Being a mom, business owner, chiropractor, I am often needed by everyone else. And so the biggest challenge for me is creating space where I get to exist without anyone needing me. Some days I can accomplish it, and other days I cannot. Exercise, nice weather. This morning I went out for a walk, and oh my God, it's so gorgeous out. And honestly, this is going to sound really ridiculous. My dog.
Aww,
Yeah,
that's
Love
great.
for my dog, because that's an unconditional constant. And I love that she doesn't really need much from me.
That's
Yeah.
so sweet. What kind
I
of
love
dog?
that.
What kind of dog is she?
She's a Beagle Collie mix, and she's just...
This is like the best dog you've ever met. She has the best personality. She's like a human, and she is like so sweet and so friendly, and like she's such a sweet.
Oh, I love good
Thank
puppy
you.
snuggles. That's great. I love that.
Yes.
Nice.
Yes. And that's probably what brings me my nirvana more than anything, is coming home to her, because she is just always super happy and only wants to just
And
love
she's obsessed with you.
and I'm obsessed with her. So it's
I don't
great.
blame you. She's the
Thank
sweetest.
you.
That's so sweet.
So I have a quick product review that I think, Debbie, you might have an opinion on, which is why I wanted to review this today. And I don't have a full review because I'm still trying it. But I recently got this LED lights, like this red light. I'm going to put it in the screen.
I saw that in your bedroom, and I was like,
Yeah.
what is this contraption? I'm not surprised
Yeah.
Amy is the one that has it.
Of course. So I've been wanting to try red light forever because I've heard it has really great benefits, anti-inflammatory. It's supposed to be really good for so many different issues. And this one I got on Amazon, but I had seen it because I got a facial a couple of months ago or something. And the woman, when she had my mask on or something, did this red light, but it was like a portable one. So we'll share a picture of it on our Instagram, but it's kind of like a small little LED light that's flexible and can go over your face. So you just sit there for 10 minutes or 20 minutes and it goes on your face. So I haven't carved out enough time to do it. Like a lot of people do it daily, a couple times a week. I have noticed that when I do it, my skin does look good, but I know it's cumulative. But I would love to hear your thoughts, Deb, on red light therapy, because I know it's very much like in vogue right now and a lot of people are starting to use it. But I have heard it has incredible benefits, but I want to hear your point of view on it.
Well, I don't really know a lot about it in terms of facial rejuvenation, but I would love to come over and try it at your house. But I know that my acupuncturists, we have red lights. We have red light lamps in my office, and I dry needle and they do acupuncture. And when I have the needles in the person's back, we put the red light on top.
Yeah.
And it's supposed to help further the benefit of the needle into the tissue. So I know that there's definitely some, Eastern philosophy that the red light is really helpful, and that it really can benefit tissue and wellness and reduce inflammation and all of that. So I would imagine it should be good for the face. I've never tried it.
Yeah. And this one, actually, I use it for my face, but like if I had, joint pain or something, they say this is flexible. So you could like put it on your arm. You could put it on your leg. You can really put it anywhere. We were actually thinking, I don't know if we're getting one, but we've been researching like the red light saunas, like the big ones that you can walk in, because it's supposed to be just so good for you, like for every part of your body. So anyway, I'm testing it out. I'll keep the audience informed on it, but so far so good. Just got to carve out a little bit more time for it, but that's a fun one.
And Amy, what was the brand and the name of that, and how much was it?
Oh yeah, sorry. This one I researched. This one's on Amazon. It's called Hydra Skincare PDT LED Light Photodynamic Facial Skincare Rejuvenation Photon Therapy Machine. It's $279. I will put a link to it, but I had researched this one and I feel like this was the one she had recommended, et cetera. So we will talk about that. And just for everyone listening, if anybody wants to reach out to Debbie, I would say to go to your website, right, Deb? Is that the best place for people to find you? It's blockchiropractic.com.
No, it's actually
chiropracticcenter.com.
Sorry, it's
Block Chiropractic Center.
Okay, great. And there's a contact on there where you can just click and send an email and it'll come right to us if you're interested.
Okay, perfect.
Yeah.
And we're going to close. Go ahead.
No, I was just going to say that besides chiropractic, there's also acupuncture and massage therapy too, if that was something else that somebody wanted to look for. And we can do a podcast in the future talking about those things.
I know. I would love to. And I was saying to Debbie when I was there, I'm like, I need to spend a whole day here. I need to get adjusted. Then I need to get a massage. Then I need to do acupuncture. These are all the things that I love. This is like a Nirvana day for me. Okay. And we always like to go ahead.
Yeah.
Sorry.
I was just going to say, like, that's something that I love so much about what you do. It's like, it's holistic. You're approaching the body holistically. And I think it's great. When we first started thinking about doing this episode with you, you can think, like we were saying before, like the chiropractic care, it's just adjusting the bones and the spine, but it's so much more than that. And I love that our listeners learned that today. And I just love your approach and everything. So thank you for being with us today, Debbie.
Thank you, guys. I really appreciate you having me.
All right. Yeah. And we always like to close out with a mantra to set a tone for the end of the episode. So Katie has one for us today.
I do. And it is, be kind to yourself. Your body is a temple and you are the goddess that resides within it. So take care of your body and go find a chiropractor.
That's a good one for this episode. It's perfect. Thank you.
Good one. Thanks, Deb. Thanks for listening to Nirvana Sisters. For more information on this episode, check out the show notes, please subscribe, and leave us a review. Also, find us on Instagram at Nirvana Sisters. If you loved what you just listened to or know someone that would, please share it and tag us. Tune in next week for a fresh new episode of Nirvana Sisters. We'll continue to watch out for all things wellness so you don't have to. Bye.